today we're doing Charrette's wrist protocol. So first we're going to start with a muscle test. So you're going to put your thumb and pinky together. You're going to resist. And it's a grade 4 or lower. We're going to start with the scaphoid. So we're going to start at the Lister's tubercle, over scaphoid, and then triquetrum, lunate, and then we're going to do the distal radius and ulna. Squeeze about 3 times, and then we're going to do the carpal, metacarpal, and then carpal spread about 3 times, and then we're going to do the distraction of the distal row. So first is the trapezoid, and then capitate, lateral hamate, and then hamate, and then we're going to retest. So can you hold your thumb and pinky together? And then it's a grade 5. Now we're going to do Charrette's protocol on the elbow. We're going to find a posterior lateral radius. So first we're going to bring the arm into supination and pronation, looking for where it stops. And there's spongy and supination. So then we're going to rub the cross fibers over. And then we're going to contact the radial head. Bring extension, and it's a lateral to medial P to A thrust. And then we're going to retest it. And then there's no more sponginess and supination. Okay, so now we're going to do posterior ulna. I'm going to test and see if there's pain on her medial epicondyle. And there is. So now I'm going to rub her cross fibers. And then I'm going to extend. And then contact the olecranon. And then it's a P to A thrust. Okay, so now I'm going to do an alternate elbow. First, we're going to do a neutral tricep muscle test. So then resist, and it's a grade 5. So then we'll move on. We're going to test for the ulna, and resist, and it's a grade 4 or lower. So I'm going to assess it as a posterior medial subluxation, which is most common. And then I'm going to have a second metacarpal joint contact on the olecranon, and it's a anterior lateral adjustment. And then I'm going to retest it, and it's still a grade 4 and it's weak. So then I'm going to assess it as a posterior lateral ulna, and then we're going to contact the olecranon with the second metacarpal joint, and then it's going to be an anterior medial adjustment. And I'm going to retest this, and it's a grade 5. So now we're going to do a neutral tricep test. I'm going to ask the patient to resist, and that's a grade 5 or strong. And then we're going to do a wrist extension, resist, and that's a grade 4 or lower, and it's weak. And then we're going to do a brachioradialis test, ask you to resist, and that's a strong. So then a weak tricep and a strong brachioradialis indicates a posterior lateral radius. So I'm going to do anterior medial adjustment, patient's arm pronation. So I'm going to contact the radial head with my thumb, and then I'm going to roll off. And then if there is a weak tricep and a weak brachioradialis, it indicates an anterior medial radius. So then I'm going to contact the wad of 3 with my thumb, and then it's going to be a posterior lateral adjustment. So now we're going to retest the tricep. I'm going to ask the patient to bring her wrist into extension, and resist, and then it's grade 5 or strong. So now we're going to do Charrette's protocol on the shoulder. I'm going to ask the patient to raise their arm at 90 degrees. I'm going to ask you to resist, and it's grade 4 or less. I'm going to ask the patient to scoot over, and then can you look that way, and then put your other arm across your chest. And then we're going to do a wrist extension. So we're going to apply 10 and 15 pounds with the pressure hands, and then 10 pounds on the speeder hand and contacting the mid clavicular and axilla. And then we're going to retest and raise your arm and breathe, and then resist, and it's a grade 5 strong. Nice. So now we're going to do Charrette's protocol for the AC joint. And then let's do like this, and then I'm going to be press their arm on my shoulder and behind them, contacting their joint with my cyst. And then I'm feeling for sponginess, which there shouldn't be, and then it's a straight inferior adjustment. Okay. The trigger points of the shoulder. First, we're going to start with the subclavius muscle, and then the infraspinatus. And then we're going to do the levator scat. And then we'll move on to the lateral deltoid. So you're going to find deltoid tuberosity, go up and out an inch. Medial humeral head. And then we're going to do the scapular belly. And then move over to the teres muscles. And then we're going to do the scapulothoracic articulation. And then we're going to do the anterior glide of the humeral head, feeling for spraininess. And then we're going to do the levator scap tendon. You shrug your shoulder, and then you relax. So now we're going to do an anterior medial proximal clavicle subluxation. I'm going to be behind the patient. I'm going to contact her left SC with my right thenar, and I'm going to go under her arm. And then I'm going to ask her to look to the right, and I'm going to rotate. Now I'm going to do an alternate anterior humerus muscle test. I'm going to bring the patient's arm up to 45 degrees and ask you to resist. And it's a grade 4 or less. You got it. Okay, so I'm going to do a supine alternate. I'm going to ask the patient to scoot forward towards me. And then I'm going to supinate their arm. And then it's a web contact, and it's a posterior adjustment. So now we're going to go into the seated alternate. So I'm going to ask you to set up. And then you're going to flex your elbow. And then it's a double palmar contact, and I'm going to support their scapula with my sternum. Find it, and it's A to P thrust. So then we're going to do the same thing laying down. So then I'm going to ask the patient to flex their elbow, and then support their scap with my other hand. And find it. You do the C-cup adjustment. Ask the patient to put their hands on their waist, and then you're going to push back into my hand. All right, and then we're going to retest. I'm going to ask the patient to put their hand at 45 degrees, and then resist, and it's strong. I'm going to do a muscle test for the SE joint. I'm going to ask the patient to invert their hand. I'm going to go slightly, mostly lateral, slightly inferior, and tweak. I'm going to ask the patient to, assess the clavicles. And then her right clavicle is superior and medial. So I'm going to ask the patient to lay on her right side. I'm going to go behind the patient, and support the patient's head. And then I'm going to contact her SC. And then it's going to be an inferior lateral adjustment. Head. All right, I'm going to lay on your back again. I'm going to retest. I'm going to invert her hand, and it's a grade 5. So next we're going to go assess for the AC joint. So I'm going to ask the patient to flex, and then I'm going to take it up and then out 45, and then resist, and it's a grade 4 or less. You sit up. And you can contact her AC joint with my cyst, and then it's going to be a straight inferior adjustment. And then retest. And this, grade 5. And next we're going to assess for the bicipital tendon. Alright, and resist. And it's a grade 4. So I'm going to ask the patient to sit up. Okay, just going to cross the arm. Find the tendon. And then out. And then the adjustment is medial. And then I'm going to retest. Resist, and it's a grade 5 or strong. Now I'm going to muscle test for an anterior inferior humerus. Ask the patient to raise his arm at a 45-degree angle, and then resist. And it's a grade 4 or less. And come, and then support his scap with my other hand. And peel around for no movement. And then straight posterior adjustment. And then to do the seated one, ask the patient to sit up. Behind the patient, ask her to flex your arm. And then we'll support his scap with my sternum, feeling again for no movement. And it's straight posterior, slightly anterior, no, slightly superior adjustment. Patient lay back down again. And then retest. 45-degree angle and resist. And it's grade 5. Now I'm going to ask the patient to flip over so I can test for a posterior humerus. Ask the patient to put this arm on his lower back. Be on the opposite scap. And I'm going to resist. Grade 4 or less. So I'm going to internally rotate his arm and then provide a slight distraction, and then it's an anterior adjustment. And then I'm going to retest.